And I'm also going to assess for sensation. If I touch you on both sides there, Colin, does that feel normal?
It does, yeah.
Thank you. So could I ask you just to turn your hands back over for me? That's great. Thank you. So now just going to gently squeeze across the MCP joints. I'm just watching Colin's face. Can you just let me know if that's uncomfortable at all?
That's fine.
That's okay. Thank you. And on the other side. Okay, that's great. So now I'm just going to bimanually palpate some of the MCP joints. Again, watching Colin's face. That's uncomfortable, no? And it's quite difficult to pick it up. I'm struggling to pinch it, particularly as I get further down the arm, and that's very typical of scleroderma. I'm just going to look at capillary refill by squeezing the nail bed. Do the hands feel cold? Thank you. On the hand movements are restricted by skin thickening.
Eyes, okay.
Up. Down. Up. Down.
2 seconds.
Close your eyes, please, and I'm going to touch you with a cotton wool, and when you feel it, could you please just say yes?
Yes. 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 Yes.
I'll just spread your fingers apart a bit. Yep.
Yes. 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 Yes.
And you can test.
Yes. 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 Yes.
Then moving to the feet.
Yes. 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 Yes.
That's enough, and then we'll do the same thing with the pin. I'm going to jab you with a pin.
Mm-hmm.
Can you tell me what you feel?
A little prick.
Okay. And so when you feel the prick,
Yeah.
say yes. If you don't feel the prick, just say whatever you do feel.
Yes. 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 Yes.
And then on the feet, it's just the big base of the big toe.
Yes.
And the base of the
Yes.
little toe. It's usually not too sensitive right out by the nail, so I usually just do there. And same on this foot.
Yes. Yes.
Right. So Duncan, this movement's up,
Mm-hmm.
and this direction's up, and that direction's down.
Mhm.
Okay, so that's down, that's up. Okay. Close your eyes, tell me which way it goes.
Up. Up. Down. 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 Up.
Cool. And then we'll do the toe. Okay.
Okay.
So same story.
Mm.
This way's up.
Mm.
This direction's down. Okay. Which way is that?
Up.
Okay. Close your eyes now. Yeah. Good.
Up. Up. Down. Down.
And then make the movements quite small.
Down. 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 Up. Up.
Okay. And the important thing to notice is holding each side of the toe like this, not like that. Okay. And the same applies to the finger. Thanks. You can stop there.
Now let's check each finger.
Now palpate the medial and lateral aspects of each interphalangeal joint between your thumb and index finger, noting any swelling, bogginess, bony enlargement, or tenderness.
Good.
To detect joint fluid more easily, feel for it with one hand while using the other hand to compress the joint antero-posteriorly. To detect tenderness in the metacarpophalangeal joints, squeeze the patient's hand between your thumb and fingers.
No.
Okay.
Then examine each metacarpophalangeal joint. Place your thumbs just distal to the knuckle on each side of the extensor tendon. Your fingers should be on the head of the metacarpal in the palm. Note any tenderness, swelling, or bogginess. Next, palpate each wrist joint with your thumbs on the dorsum of the wrist and your fingers beneath it.
Plane. Without forcing anything, I move the patient's head as far as possible, parallel to the patient's shoulders to the left and right. I have the opportunity to bend the fingers a little and can apply light acupressure bilaterally on the upper transverse processes of the cervical spine. The belly of the bicep muscle. This treatment part is often a positive effect on the circulation and breathing. The patient breathes more deeply and is more relaxed. The lateral head acupressure points and meridians are important. At the end, you gently stroke the neck again as at the beginning. Gently I end the treatment. Contributing factor to migraine. In the next step, I acupressure the side of the skull while moving the scalp a little. In addition, you could now treat the Chinese meridian line and their acupressure points. I do not show that here. I could also integrate an intensive treatment of the entire jaw muscles in this position. Now I stroke the neck muscles again in both directions and press my fingers downwards. There is an important Chinese acupuncture point, gallbladder 21. This point is very effective against headache and shoulder pain. This point can also be a trigger point or a tender point of the trapezius muscle. If there is trigger point activity, the pain radiates to the neck and head and or to
the posterior aspect of the elbow for any abnormalities. So we're looking particularly here for any scars, any visible swelling or deformity, and you can look on both the lateral and the medial aspects. You may also see other things on the back of the elbow, such as rheumatoid nodules. You may see a swelling over the olecranon in olecranon bursitis, or you may also see psoriatic plaques. Temperature is assessed by feeling with the back of your hand above the joint, over the joint and below. And then I'm going to palpate the structures around the back. So again, palpating over the olecranon, which might be tender if someone has olecranon bursitis, and then over the medial epicondyle, which might be tender if the patient has medial epicondylitis or golfer's elbow. Finally, I'm going to palpate over the lateral epicondyle. This might be tender if the patient has lateral epicondylitis or tennis elbow. So now hold the joint to see if there's any crepitus. So if you just let your arm relax. Thank you. And you can palpate the radial head while you're doing this pronation, supination movement.
So move on to examine the patient's feet. I'm going to look for any callus formation on the soles of the feet, and I'm going to squeeze gently across the metatarsal phalangeal joints while watching the patient's face. Any pain?
No.
Each finger together for me. Precision pinch is important for assessing concentration and smoothness. And then I'm going to do a grip strength test where I ask the patient to squeeze as hard as they can and relax. Gently squeezing across the metacarpal phalangeal joints screens for inflammatory joint disease.
Great. Keep them there. Don't let me push them down. So that's me just testing radial and ulnar nerves. And then if I could ask you to turn your hands over, point your thumbs up to the ceiling, keep it there, don't let me push it down. And that's testing the median nerve. Next, I'm just going to ask you to bury your fingers for me. Technique to examine the proximal and distal interphalangeal joints. So wrists should also be examined using 2 hands and checking for pain. Thank you.
Le orbital, par exemple, va commencer à vieillir. On voit apparaître les petites rides, différence de coloration, des petites rides, là, par exemple, autour des lèvres. À la quarantaine, les sillons commencent légèrement à s'approfondir. Donc, on va retrouver les sillons nasogéniens, les joues commencent à se creuser légèrement, les coins de bouche, les commissures des coins de bouche commencent à s'affaisser. Puis à partir de la cinquantaine, tous ces phénomènes-là vont s'accentuer. Donc, on aura toute la région périorbitaire, par exemple les petites rides, le creusement de la vallée des larmes, le creusement dans la région des joues, le creusement des sillons nasogéniens, les coins de bouche vont s'affaisser. Puis,
when you're at the hairdressers, you can hear the hair move. Your client shouldn't really hear that because it's the whole scalp that's moving. I'm pressing down and I'm making sure that I move the skin. It's not like being at the hairdressers where you're moving the hair. You're actually pressing enough so that you move the skin underneath. The skin should be fairly free-flowing across the scalp. You will find that, particularly for people who grit or grind their teeth, that some...
Hello, I'm Ulf Pape from Germany. This short tutorial is about a Finnish rich mineral treatment of the hand. Here you can see a typical grip from the traditional Thai massage. Stop the clip and perform the grip with your partner's hand. Position yourself centrally above the wrist. First do the acupressure from this point evenly in the direction of all base joints of the fingers and the thumb, up and down. At the same time you touch important hand reflexology points. The fingers on the back of the hand do simultaneously acupressure on the area between the extensor tendons of the fingers. Your power comes from your center of gravity. On the middle line towards the big finger, use both thumbs. On the next step, cross your thumbs and rhythmically stretch the bones of the lower and middle hand apart, which has a mobilizing effect.